Hey guys, I'm going to cover age-related degeneration of the spine, or age-related things that you see associated with lower back pain, and really if lower back pain and age are even related at all. And so it's a common thought that the spine just starts to kind of degenerate, as they kind of say, and they started to make a diagnosis called degenerative disc disease. And so what I thought I'd cover today, first to figure out if there's really any merit to that, based upon current research that we have. So hang in there with me. I'll try to make it as interesting as I possibly can. But this is critical information for you guys to decide really if you find it worth your time to get better or not. Because if this was age related, why would you try? I'll cover degenerative disc disease, or DDD as they call it, from a standpoint of Dr. Google, and I just Googled this earlier. So this is what you guys are probably reading already. And so they call degeneration of the spine osteoarthritis of the spine, usually neck or lower back. It's funny, they call it different things, you know. And so this is a condition of the disc between the vertebra with loss of cushioning, fragmentation, or herniation related to aging. And it sounds terrible, right? So there may be no symptoms, it says. In some cases, the spine loses flexibility and bone spurs may pinch on nerves, causing pain and weakness. Treatment can include exercise, medication, and physical therapy, it says. Now, here's the thing, is degeneration of the spine is a really old term that a lot of docs used to use. And most people who are really evidence-based don't tend to even use that much anymore, because it starts to lend into the idea that something is degenerated and it's not going to come back. Now, will the spine actually change? Is the goal to actually change the spine to feel better? Not necessarily. And so we like to call this gray hair of the spine. As we know, gray hair does not hurt. It's just gray hair. And so it's not really a big deal. And you might be thinking, well, what do you mean it's not a big deal? It hurts. Well, yes, it hurt. Your back might hurt, but the degeneration does not. And so there was a research article here that I pulled up just to show you guys. This was from 2003 from the Spine Journal. And so basically, I'll read this for you just verbatim. And so disc herniations, osteophytes, stenosis, and end plate irregularities were not associated with lower back pain. I'll read that one more time. So MRI findings such as disc herniations, osteophytes, which is also bone spurs, or what they mentioned as degeneration, stenosis, and end plate irregularities were not associated with lower back pain. They also mentioned further that disc height and tears only explain 6 to 7% of all lower back pain cases. That's interesting, right? Because Dr. Google's already saying that degeneration is one of the most common reasons for lower back pain because of loss of disc height. But this article says that the science says that disc height really doesn't have a large relationship with it. So you might be wondering what's going on here. Like, why am I hurting? Why am I seeing all these effects within the MRI and X-ray? And how do I get rid of it? Well, so first I'll start out with what's happening. And so the current thought is that the X-ray and MRI findings are actually, they're signs of things that have happened. They're signs of things that have happened, meaning you hurt yourself way back in the day with your back because there was a poor lift, you sat too much for a year period of time, and it started to show signs of your quote-unquote degeneration. Sometimes there is herniations, extrusions, and all these other things associated with it, but for the most part, this image shows a sign of something that happened, not a sign that something currently hurts, okay? And so with that being said, the image isn't necessarily needed to indicate that you're in pain. What we think is happening is that rather than identifying structure on the image, like the MRI and the X-ray saying, okay, that's the problem, we can see it, actually we think there's more of a physiological response happening, which is something that you can't see on image at all, which it gives to light the reason why things like herniations, osteophytes, stenosis, end plate irregularities, disc height, and tears really don't have a strong relationship with back pain, even though someone probably told you that it did. So the physiology comes down to what's happening within the areas that the image cannot see, which is challenged by how you move. Now, originally we could have said 10 years ago you might have had your first issue with back pain, you bent over, picked something up, you deadlifted the wrong way, you sat too long in a chair and you got up and right? And so then you see that image finding that is currently still around, and people still think that's a symptom generated. And the fact of the matter is, most time it's not. Now I'm going to use a couple models just to give you an idea of the things that I just talked about. I know they're big words, and so I want to make sure to break these things down and give you an idea of what's happening below the surface that you might not be able to see. So in this case, I'm going to use this big model, and then we'll move back to this little one, okay? So the first thing to understand is this is actually the lumbar spine here in red, and then we have the orange, or sorry, this is yellow, which is nerve roots. We have little holes, which is called the foramen. We have this area, which is called the vertebral body, and then there's the disc right there. And so the disc, as they mentioned on X-ray, just notice, by the way, all these, this thing in the disc, you can't see on an X-ray at all. And so if someone's telling you that you have issues with your disc or your nerves on an X-ray, they can't really see it. It's all theoretical. And so on an MRI, you can see these structures, and sometimes they'll show signs of something that did happen, but it's something that's not currently an issue. So what they were mentioning was disc height. So the space between these two red spots have narrowed, okay? Or they'll say that there's stenosis, which is narrowing of a hole, which is the side here, which is the foramen, or on the top, which is in through the center, which is not going to be seen on this model. Now, the important part I think we need to cover is this one today, okay? And so let me make sure it's zoomed in there pretty good, because I want you to understand the small intricacies that could be happening within the spine area, which are challenged by the movements in the way that you move your body. So this is the disc, again, this is the top, and so I mentioned all those things that could be happening on the inside, which is not really seen very well with an X-ray or an MRI. And so the theory is that when you've injured yourself in the past and you've had an issue with back pain, there's these little red, blue, so those are vessels. Vessels start to grow inside this ring right here, which is called the annulus. The annulus usually doesn't have a lot of blood before you get injured, but also too, what comes in with the vessels is nerves. And so as these nerves start to enter the outer third of this ring, what happens sometimes with something like sitting too long today, this little jelly material in there, which moves around as you bend forward and bend backwards, it starts to work its way to towards and into the rings. Think of those rings as like yarn. It just kind of soaks up some of this nucleus or some of that jelly, and at some point it hits the outer third and it sends off pain. Now, think about that, because your pain can be set off with a movement which moves stuff inside the disc just enough to where it hits a nerve inside the disc, not one of these big guys, and actually you don't have a positive imaging finding at all. It won't show the nucleus moving out. It doesn't even hit the osteophytes or the degeneration. It has nothing to do with that stuff. And so according to what we know in this research here, again, I'm going to keep saying it, herniations, osteophytes, stenosis, end plate irregularities, disc height, and tears have very little to do if you are still in back pain, okay? If you're still having it. What we need to do is improve the way your body is working on the inside to keep these areas to stop being challenged in a bad way, because your movements are what's causing this. Your movements are what started it, and your movements and your crummy movements and the way you pick things up and lack of activity are what are creating this thing to keep happening, okay? So what we need to do is improve the way you move, not to get another image. As we see here, here's the last line. I didn't read this one yet, but this one's a good one. MRI assessment, our results suggest that the use of MRI assessments of annular tears and disc height alone in clinical practice would be of limited value. Okay? So if you're going to a place that is only doing imaging to make a decision about what to do with you, there's so much more. And that's why we like to see you move. We like to see a movement assessment. We like to see how you're habitually doing things. And we just need to build a nice program around that to get your body's physiology, not the structure necessarily, to improve. Simple, right? Movement is medicine and motion is lotion. I would not try to make it more complicated than that, although this video is probably very complicated. All you have to remember is all those things, all those structures, and all those things that they're pointing at on the image and saying that are your problem are probably not. Okay? Once you get over that hump, that mental hump of thinking that this is just age-related or that you're broken, you're going to improve probably very quickly. And so let us take you down this journey. We're here to help. All you have to do is let us watch you move first, and we can create a custom program for you, whether you're in our office or we're doing virtual. It does not matter. We have to see you move. We can suggest from there because we have a good keen eye for it. So let us help you out. We'll take care of you on this side.